We only get so much tooth enamel. What erupts in the mouth when the tooth first comes there, that's what we have. So if we file it away, we're taking it off and making the teeth less well defended against acids and decay, and more sensitive. And teeth are shaped. Our teeth have very specific shapes because they perform certain specific functions. If we change and alter that shape, then the tooth isn't going to function like it's supposed to. I would try to avoid some of the DIY TikTok trends for whitening. There's talk about charcoal. Charcoal's very abrasive. So, can I whiten teeth by using an abrasive? Yes. In the same way that I can take my hardwood floors in the house and make them lighter by sanding them, that I can make them lighter until I run out of wood floor. With abrasive techniques of whitening teeth, we can whiten the teeth until we run out of tooth enamel. And there's only so much tooth enamel there. It's a fairly thin layer. And if we wear it away faster than we should, yes, the teeth will get whiter, but then for a while. But then they become sensitive and eventually they become yellower. And then as a dentist, I have to fix that and replace enamel. We've seen a rise on social media talking about DIY orthodontic trends and putting rubber bands around teeth. And one of the things to remember is the part of the tooth that we see, the crown, that's only about a third of the tooth. It's like teeth are like icebergs. So there's a lot under the bone, under the gums and the bone that we don't see. So if I had two teeth that were apart and I put a rubber band on, can I move them together? Yes. But what am I doing to the roots underneath or the parts that I can't see? Teeth are not tools. So don't use your teeth to pull those little price tag plastic tabbies here or open packages. Tooth enamel, teeth are constructed and they do really well in crushing force, but bending, pulling forces like that, that's where teeth break. There's always talk about, what do dentists give out at Halloween? And, and am I the anti-candy guy? It's like, no, everything in moderation is fine. What we want to try to do is the bacteria that are present in the mouth burn sugars, and the byproduct of the bacteria burning sugar is acid. Acid dissolves tooth enamel. That's what causes cavities. So what we want to do is minimize the number of exposures that the bacteria have to sugar. So if we're sipping soda all day, we're basically washing the teeth in an acid bath. If we're eating lots of Halloween candy, we're increasing the amount of food that the bacteria have, the amount of sugar they have to burn to make acid. So let's try to move our Halloween candy with meals. As a dessert after dinner or after lunch, and not snack all day with it. How sticky is it? Things that are naturally acidic taste sour. So a sour candy is already starting in an acidic pH, so the breakdown of the teeth is faster. Something that's caramel is really sticky and sticks on the teeth. If we can't get it off, then the bacteria will get it off for you eventually by burning the sugars and making acid. So, what do dentists give out at Halloween? Chewing gum and chocolate, actually, among my choices. Chocolate is sugar. Chocolate tastes great, but it's easier to clean off the teeth than something very sticky. The best things we can do for our oral health: stay very hydrated, drink lots of water. Americans in general are chronically dehydrated, so let's hydrate. Brush twice a day with a fluoride-containing toothpaste. Floss once a day or clean between your teeth with a water flosser. Eat a healthy diet, lots of color on your plate. Fruits and vegetables do a nice job of naturally forcing the teeth cleaner. and seeing your dentist on a regular basis so we can help you design a plan that's the best and most healthy for you.